Good morning. Today we are discussing Valacyclovir, a cornerstone of oral antiviral therapy for herpes virus infections. It represents a significant advancement over its parent compound, Acyclovir, primarily by enhancing oral bioavailability. As front-end clinicians, understanding the nuanced pharmacology of this prodrug is essential for maximizing efficacy and ensuring patient safety. Valacyclovir is chemically the L-valine ester of Acyclovir. Its brilliance lies in its design as a prodrug. Following oral administration, Valacyclovir is rapidly and near completely absorbed from the gastrointestinal tract and immediately hydrolyzed by the enzyme valacyclovir hydrolase, largely during the first-path metabolism in the intestine and liver. This swift conversion yields high systemic concentrations of the active drug, Acyclovir, and the harmless amino acid valine. The enhanced oral bioavailability, reaching approximately 55% compared to the 10 to 20% of oral Acyclovir, allows for simpler, less frequent dosing schedules, which profoundly improves patient adherence, a critical factor in chronic suppressive therapy. Mechanism of selective action. The active moiety, Acyclovir, is an acyclic purine nucleoside analog whose mechanism is uniquely selective for virus-infected cells. The first and most critical step in its activation is the phosphorylation to acyclovir monophosphate, a process catalyzed almost exclusively by the viral thymidine kinase of the herpes group viruses, HSV1, HSV2, and VZV. Because host cellular kinases have a vastly lower affinity for acyclovir, uninfected human cells are largely spared, which accounts for the drug's generally favorable toxicity profile. Once formed, cellular kinases further convert the monophosphate to acyclovir triphosphate, the final and most active form. This triphosphate then acts as a competitive substrate for the viral DNA polymerase, and crucially, its incorporation into the growing viral DNA strand results in obligate chain termination. Lacking the necessary structure for further elongation, the viral DNA synthesis grinds to a halt, effectively blocking viral replication. Therapeutic indications and dosing considerations. The primary clinical indications for Valacyclovir revolve around the herpes virus family. For herpes-zoster, or shingles, the standard dose is 1 gram 3 times daily for 7 days. Early initiation, ideally within 72 hours of rash onset, is paramount to reduce the severity and duration of acute pain and potentially mitigate the risk of post-herpetic neuralgia. In genital herpes, Valacyclovir is utilized for both episodic treatment and chronic suppression. Episodic treatment for recurrent outbreaks often involves a short course, such as 500 milligrams twice daily for 3 days, or a 1-day high-dose regimen for cold sores. Chronic suppressive therapy is often dosed at 1 gram daily, demonstrating efficacy not only in reducing recurrence frequency, but also in lowering the risk of sexual transmission to uninfected partners. Valacyclovir is also approved for the treatment of chickenpox in pediatric patients. Safety profile and clinical vigilance. While Valacyclovir is generally well tolerated, vigilance is required, particularly regarding renal function. Since acyclovir is predominantly excreted by the kidneys through a combination of glomerular filtration and tubular secretion, renal impairment necessitates prompt dose reduction based on the patient's estimated creatinine clearance. Failure to do so can lead to systemic accumulation of acyclovir and its metabolites, precipitating severe central nervous system adverse effects, which may include agitation, confusion, hallucinations, or seizures. This risk is notably higher in the elderly, who often have occult or age-related renal function decline. Furthermore, patients must be instructed to maintain adequate hydration to prevent crystalluria and subsequent acute renal failure. A rare but devastating adverse event, Thrombotic Thrombocytopenic Purpura or Hemolytic Uremic Syndrome, TTP or HUS, has been associated with high-dose or prolonged Valacyclovir use in severely immunocompromised patients, such as those with advanced HIV or post-transplant status. Clinicians must immediately discontinue the drug if TTP or HUS is suspected. In summary, Valacyclovir stands as a highly effective and generally safe oral antiviral agent. Its improved pharmacokinetics allow for therapeutic simplicity, making it a critical tool in managing a range of herpes virus infections. However, its use demands a firm understanding of its renal elimination profile and the associated risks, particularly in vulnerable populations. Thank you for your attention. Please let me know if you have any questions.